I'm Dr. Sarah Chen. For 22 years, I've been a stroke neurologist at Johns Hopkins, and I've treated thousands of older patients whose lives were changed, sometimes forever, by something no one ever talked about in medical school, the way they sleep. Today, I want to share what I've seen in clinic, the startling patterns that kept showing up on scans, and what many hospitals are quietly updating in their discharge instructions. This isn't meant to scare you, it's meant to give you information so you can ask the right questions of your doctor. Think about this. How many pillows do you sleep with? How do you position your head and neck? I used to reassure patients that sleep position was comfort, not risk. I was wrong. Over the years, a pattern emerged. People sleeping flat, face down, tucked with their arm under a pillow, or even sleeping with a blanket over their head, were showing up with the same kinds of vascular problems and, sometimes, strokes. In a group of patients I reviewed, I started seeing a distinct pattern. I call positional stenosis, localized narrowing that appears to be linked to chronic compression from certain sleeping habits, when blood can't drain or flow properly. For hours at a time, especially in aging vessels, the risk of clot formation and silent damage goes up. Let me tell you about Leonard. He was 77, a former Navy mechanic who slept flat, no pillow, hands folded across his chest, a habit he kept from service. One morning his wife found him awake, but unable to speak or lift his arm. Scans showed a clot in his left middle cerebral artery. We traced an unusual pattern of narrowing in his neck vessels that correlated with the way he slept. A simple wedge pillow, the kind you can buy for under $20, changed his overnight drainage and his risk profile. That single low-cost change might have prevented that stroke. Ethel, an 82-year-old retired teacher, had slept face down for decades. Turning the head sharply for hours put compressive strain on her vertebral arteries. She suffered a cerebellar stroke that left her balance and independence dramatically altered. In another patient, chronic side, sleeping with the arm under the pillow slowly pinched carotid flow over many years, producing what looked like progressive arterial narrowing on ultrasound. These are real people, neighbors and grandparents. Their stories are why I started paying attention to sleep the way cardiologists watch cholesterol. There are other common situations I see again and again. Sleeping with heavy covers over the head can reduce oxygen and raise overnight carbon dioxide in a vulnerable older person. Sleeping upright in a recliner after surgery can promote leg, blood pooling and clot formation. And missing nightly medications that control blood pressure or anticoagulation can turn an otherwise quiet night into a dangerous one. Restless tossing and turning, common with age, can create intermittent drops in cerebral blood flow that add up over time. Look, this isn't about blaming anyone for how they slept for decades. It's about awareness. Small changes in how you sleep, supportive neck positioning, avoiding excessive compression of the neck and chest, ensuring adequate nighttime oxygenation, and taking prescribed evening medications on schedule can make a difference. In our clinical practice, we began teaching a simple positioning approach, elevating the head modestly, supporting the neck, and avoiding chronic twisting or compression. And we saw fewer episodes of overnight symptoms and fewer alarming vascular changes on follow-up scans. I'll also say this. Before you try any new technique or device, discuss it with your physician, especially if you have known vascular disease, atrial fibrillation, sleep apnea, or are on blood thinners. If you or an older loved one wakes up dizzy, confused, with slurred speech, weakness on one side, or sudden visual changes, treat it as urgent. Call emergency services right away. Minutes matter with stroke care. I'll be sharing practical tips and the simple pillow positioning we use with patients in the next video. And I'll walk you through what to ask your doctor and what to look for. Subscribe to the channel so you don't miss it. And if this resonated, share it with anyone you know who sleeps in one of the positions I described. Knowledge can save a voice, a memory, or a life, and sometimes the smallest change makes the biggest difference.